Welcome to the EADV Podcast. In today's episode, Professor Jan Gutermuth is joined by two renowned experts in migrants' health, Professor Aldo Morrone, Scientific Director at the San Gallicano Institute in Rome, and Dr. Valeska Padovese, Special Advisor on Migrants Health and HIV at the International Foundation of Dermatology in Malta. But before we get into that,
did you know the EADV started in 1987 with 21 founding members and has now grown to over 11,000 passionate advocates for patient care in dermatology and venereology? We are a diverse community with members representing 125 different countries. If you would like to learn more about our membership benefits, or if you wish to join the community of like-minded professionals, go to eadv.org.
Together, Professor Morrone and Dr. Padovese clarify terms like migrant, refugee, and asylum seeker. They share insights into common skin conditions among migrants and emphasize the importance of compassionate, culturally informed care. Stay tuned for an enlightening discussion.
Hello and welcome to the EADV Podcast. Today, we have the great pleasure to welcome two world-renowned experts on migrant health. It's Professor Aldo Morrone, who is the Scientific Director of the San Gallicano Institute in Rome. And Aldo, we will hear later more about this institute, which has already a 300 years history and experience on these topics. And also with us today, we have Dr. Valeska Padovese, who is currently located in Malta. She's the special advisor on migrant health, STIs, and HIV in vulnerable populations to the International Foundation for Dermatology and the ILDS. And she's also the senior consultant dermatologist and venereologist at the Sexual Clinic in Malta Ministry for Health. Welcome, Valeska and Aldo. Thank you for being with us. And before we start about diseases and percentages, I would like maybe to start to ask Valeska, if you talk about the word migrant, are there some definitions that you need to know? Because there are many terms used at the moment, migrant, refugee, asylum seeker. Is there something we need to know, like in basic terms, to start?
Yes, thanks, Ian, for the introduction. So the terms is usually, the terms migrants is used as a big umbrella terms that involve both migrants, refugees, asylum seekers, and also economic migrants or internally displaced person. Is a huge term, so it's important that we define the different population, because there are differences inside the different groups of people on the move. For instance, refugees are those people who fled from war or conflict or a situation of instability, and they seek for asylum in the countries where they fly to. And they have the right by international law of protection. Asylum seekers are migrants who move from their country of origin and apply, and they seek for asylum in the countries where the countries like our countries, for instance. And there is in these terms, a refugee is a person with an entitlement, with a refugee status, whereas asylum seekers are people who are still in the process. Migrants, international migrants, or what we define as economic migrants, are migrants that move to escape poverty, so they have other reason to flee from their countries. Nowadays, there are also new categories of migrant. We can talk about environment migration, so migrants also move because of climate change, or and also this kind of people, this kind of migrants have the right to seek for asylum because they cannot live in the country of origin because of natural disaster, for instance. And there are the internally displaced persons, or internally displaced people, who are the people who move inside the same country of origin. For instance, the recent conflict in the Gaza district has caused a displacement, a movement of people from the south of Lebanon to the north of Lebanon. These are internally displaced persons. And hopefully these people try to move back after the conflict, after the instability stop, and when safety is reestablished in the country of origin. So it's a bit difficult sometimes to move between a definition and the other, but that's why we use the term, the overall umbrella term of migrants, international migrants, or as Professor Aldo Morrone teaches, people on the move, we also call them, which is also very interesting because there are not only people who migrate to our country, but also ourselves who migrate because we move for reason of traveling, tourism, of work to low and middle income countries, for instance, and so move infectious diseases or skin diseases as well. So that's why we see maybe imported skin condition from the country of origin, low and middle income countries, or we can identify common skin condition in migrants and refugees.
Yeah. So if we then use the term today, we will use it for people who have to leave their home due to a severe situation. We are not talking, for instance, about scientists who are going in during their career from one country to another. So, but we will now have it more on people who are due to conflicts, natural disasters, and as
mainly talking about refugees or asylum seeker or internally displaced persons, whereas migrants can be anyone like myself that moved from Italy to Malta to work or for scientific reason, as you correctly stated.
Similar, like myself, who moved through 3 different countries for work reasons. So maybe Aldo, what do we have to watch out in refugees when we look for medical conditions? What does a dermatologist have to look for?
First of all, I would like to say that now in this moment we have more than 1 billion people in the world today are on the move. It is very important. And the 300 million, they are refugees and asylum seekers. So it is very important, in my opinion, to try to take care of them, because this is important to welcome them and visit them according with the idea of a narrative medicine and evidence-based medicine. So dermatology is very important to try to recognize all the different skin lesions, because not only to realize the diagnosis of psoriasis or atopic eczema or other skin diseases on different colors of the skin, but it is very important to recognize some skin lesions that are correlated with torture or with violence. For example, we have a lot in Europe, a lot of women that they try to escape from the female genital mutilation. So it is very important that we have this ability to recognize so many different lesions. So it is very important also to visit all of them in a condition of welcome people, and with the support of linguistic mediators to try to understand better their stories, their diseases, their suffering activity, their suffering experience. It is very important. And after, dermatologists, is better to try to work with psychologists, anthropologists, and also other colleagues to realize a team, interdisciplinary and multi-cultural team. This is very important in my opinion, because it's the first sign of to try to give welcome. We are here to try to help you, starting from your skin lesion, and to recognize many skin lesions correlated with infectious diseases, these metabolic diseases, or oncological diseases. This is very important.
Yeah. So Valeska, what are the typical? I mean, we have people coming from different continents. What are the different conditions that we have to suspect? I suggest, are there differences when people are moving from the African continent or from an Asian continent or from Asian countries, and we encounter them as patients, welcome them, as Aldo says? I like the way how this is a philosophical and humanitarian way to do medicine. I think that's very important. And what are the typical skin lesions that we see? What is most important or most frequent?
Yes, we obviously need to know a bit the pattern of migration and see what is the prevalence in our countries of the skin condition in migrants according to the countries of origin, as you say. So, for instance, in Malta, what we see mainly are migrants coming from, I use again the term, the umbrella term migrants, because it's a mix of economic migrants and asylum seekers. So the migrants coming mainly from South America or Southeast Asia, so they are the most prevalent. But we still see both migrants arriving from the sub-Saharan Africa or the Horn of Africa, Sudan, from the big crisis, from Somalia, from Sudan, and crossing, or from West Africa, crossing the Saharan Desert and the Mediterranean Sea to reach Malta and obviously the southern coast of Italy. So according to the country of origin, we can see a different kind of skin condition, but the most common skin condition in both migrants, for instance, at their arrival, are those related to the perilous journeys, or the dangerous crossing, what we call, through the Sahara Desert and also the Mediterranean Sea. So usually skin condition related to the harsh of the weather conditions, or the heat in the desert, or the sea effect on the skin of migrants coming from Africa, like mainly eczema, or those who are so-called poverty-related diseases. So scabies, for instance, which is one of the most common, related to the condition in which migrants are kept before their departure to our country. So mainly in the detention center in Libya, or in spaces where obviously overcrowded spaces where it's not possible to have a proper hygiene, and also related to the decrease of the immunity because of malnutrition. Other conditions, this is not the case of migrants obviously coming by flights or with a regular visa that we see in Malta from South America, mainly Colombia, Venezuela, or Argentina, or Southeast Asia. So we see a lot of Pakistani, Bangladeshi migrants and Indians. In this case, also we can see some condition related to the sharing of overcrowded space, because also these migrants that move to our countries to find a better life because with a promise of a good job, they share apartments and they live like sometimes in 8 to 10 people in the same small apartment. So also in these cases, scabies can be one of the most common conditions. But what we have seen recently in Malta from especially Southeast Asia is the importation of fungal infection, for instance, and also resistant dermatophytosis resistant to antifungal treatment. There is an increase tendency to see cases of mistreated with a combination of antifungal, antibiotic, and corticosteroid, which increase the resistance of dermatophytes, especially Dermatophytus mentagrophytes and the variants interdigitali, or the Trichophyton indotine, which is resistant to antifungal treatment. And with a working group, a task force at the EADV, we are studying this phenomenon. We are doing some research on antifungal resistance of these dermatomycosis imported from the Southeast Asia, from Bangladesh and India. In the Colombian especially in my clinic, in my daily clinic, what I see is an increase of STIs and also an increase of cases of HIV infections in this population, especially in high risk category like men who have sex with men. Or I face many both males and females else move into countries also as victim of human trafficking and for sexual exploitation. So this is an increased phenomenon that is quite worrying because usually victims of trafficking, of human trafficking, are not easily to detect. And as soon as you suspect that a person can be a victim, usually the trafficker move them to other countries. So it's quite quite a problem that is of concern in our countries. And most of the time, medical doctors, so dermatologists and also venereologists can meet victim of human trafficking for sexual exploitation. It's also our duty to try to identify these people. With the International Foundation for Dermatology, we create also a working group, the International Dermatovenereology Alliance Against Trafficking, and we are trying to identify skin sign in victim like tattoos that the traffickers are really putting on the skin of the victim, labeling them, and this can help maybe the international dermatology community to recognize victim of human trafficking.
There are some quite frequently used tattoos. There were some recent publications. What do we have to look out? Was it I think it was for instance a crown, a gun, diamonds. Weren't there some tattoos that are quite frequently used? Unfortunately, they can also be used for decorating reason. But are there some red flags that we should have in terms of, for instance, tattoos to identify or where it should raise the suspicion of human trafficking?
Yes, we are working on this to collecting evidence and sharing experiencing among experts in US and Europe. So we are at the beginning of this work, but we hope that maybe with the help of other experts in Europe, we can better define the type of tattoos. And it depends also from the countries. I mean, what is used in US is different from what in Europe maybe traffickers use to brand their victims. And obviously, we don't talk only about dermatology and skin, but also about sexually transmitted infections. So the importance of offering testing and screening the victim once we manage to get them out of the trade of the traffic.
Yeah. Are there any other signs that need to make us vigilant for victims of torture or abuse? We know they suffer severely from post-traumatic stress disorder, depression. They can have neurological damage, chronic pain. So I think there are many reasons why we have to take care of these persons. Are there red flags? Are there things that should make us suspicious, and are there maybe some ways how we can address the patient? How would you get the trust, and what type of questions would you ask, and or how do we approach such a patient?
Yes, in my sexual health clinic, obviously the first red flag when a patient arrives is when someone else wants to enter in the consultation room with a patient. So usually they are never alone, so they are accompanied by someone else who try to enter with the excuse maybe of translating for the victim, who is always a foreigner. I had a personal experience here at the clinic with Chinese or with South American who didn't speak the language. So the first thing we have to do, we have to obviously avoid that this person enter the consultation room with the victim. And so in this case, establish the scene and explain about the confidentiality of the setting and the importance of disclosing any harm that or any situation of abuse that an eventual perpetrator can carry on the victim. But it's a very delicate situation because obviously there is a lot of fear, and usually another red flag is when you ask about the living condition and documents. So most of the victims of trafficking, they don't hold their document, but the trafficker hold the document, and they are not free. There is no freedom of movement, so they can move, they can go out of the place where they live most of the time. time the place where they work is also the place where they live. And they are really, the money that they gain from their work is they are held by the trafficker. And these are all red flags that need to raise the suspicions. In this case, obviously, we have to inform the social services and the police force to investigate in a very sensitive way, obviously, because the victim can be in danger. So it's a very delicate situation.
Yeah, and I think it's an extremely important and actual topic, and it will also be covered at the EADV Congress in Amsterdam. Thank you, Valeska, for giving us these red flags and when to become suspicious and how to act. Maybe, Aldo, can we learn a little bit? Because in Italy, you already 20 years ago, you founded a institute for migration and poverty. And we all know that poverty has the strongest link to diseases. Can you explain us a little bit about what this institute does, how you have been approaching this problem?
We founded the National Institute for Migration and Poverty because we had the privilege to visit and to welcome a lot of migrant people to come to Italy. And it was this great experience because, first of all, we have to study better the diversity of the different colors of the skin. In my opinion, we have to go in different countries to learn from our dermatologist colleague to study the different lesions on the different colors of the skin. Why? Because a lot of lesions are completely physiological lesions, are not the diseases. For example, capping, coining are lesions very, very physiological. So in my opinion, we have to write and to publish many books on the different the diversity of the skin colors in Europe and in USA. Why? Because in our university, we study dermatology and venereology, usually only so-called white skin or light skin. We need to learn. This is my opinion. So the National Institute of Migration and Poverty was born because we had the support of our colleagues. This is very important. For example, with the Professor Rod Hay and the Professor Benafse, we wrote a book around the skin disorder in migrants. This is very important, in my opinion. And also, it is very important not only to wait the people coming in our hospital, but we have to go in the different camps, in different situations where they live, not only in different countries, but also in Europe, in different centers where they are living, and to speak with them, to talk with them, not only to visit the skin, but to welcome them and to give the opportunity to realize a very good relationship with them. And after we can study, we can ask to visit their skin, because a lot of skin diseases, they don't have any symptoms. So it is very important also to realize that we need to realize a very good dermatological visit. It means, for example, to ask all them to show all the body, the skin of the body. It's not easy, for example, with the women coming from some different countries where the very important religious culture, they don't permit all this. So it is very important, first of all, to try to understand their culture, the different country of origin, and after, please, may I visit you? Please, may I see your skin? This is very important. So the National Institute for Migration and Poverty was born for this idea, to go in the different countries, like Latin America, different countries in Africa, in the Middle East, and to learn. To ask our colleagues, please teach me what is the best way to realize a very good dermatological visit, in the same time to realize, starting from the skin lesion, other very important problems. For example, when the people, they are itching, you can you can think about scabies, but not always scabies. Sometimes lymphoma, Hodgkin lymphoma. So you have to have this very important idea about the skin lesions and internal diseases, infectious diseases, oncological disease. So I think always that we have to thank our colleagues because they can teach us a lot. And I know that the European Academy of Dermatology and Venereology, they realize a lot of meetings, a lot of activity to try to understand better this wonderful idea of the diversity of the skin colors. Also because we need this idea about the ethic. Ethic is very important. It's an integral aspect of the health practice.
So I have to say thank you. I think I have learned a lot today in these 20 minutes. If we recap this, what I took from you, Aldo, that we really need to learn about the diversity of the skin colors. And I would leave it like this. We need to know the skin in all colors, and we need to learn about cultural habits to make the distinguish between cupping versus some form of abuse. We need to learn about the diseases in the countries of origin. So I think that we need much more international collaboration and maybe interdisciplinary collaboration than what we are already used to. So, it makes sense, luckily, that EADV and the other organizations, we are now actively inviting people from other continents much more. So what I understand from this is really something important, and we may need to increase this. And another thing that I have learned today is that refugees usually have very common skin diseases that can be parasitic or infectious. There is trauma from the very dangerous trip, but that we may not forget that they can also have severe, especially oncologic conditions. We need to offer STD testing, and but there was an important point that you raised, Valeska, that we need also be more and more vigilant about human trafficking, and that we need to watch out for signs of, let's say, inadequate dependency between a patient and an accompanying person, that this is an important flag, that we also need to watch out for maybe tattoos in inadequate locations. But here more research and advice will follow in the next years, and that we need to look out for scars or maybe neurological damage which are not explainable by usual trauma. When you see scars that do not fit into traumas that we know from sports or household accidents, that this should make us vigilant. At the end of the podcast, I always like to know from our speakers whether there's some important additional message that they would like to give to our listeners. Maybe we start with Aldo. Is there anything else our listeners need to know or you would like them to remember?
I think that now time is up, in my opinion. It's a high time for all of us to act all together, to put into practice the knowledge that science, dermatological science, is offering us in order to promote health and dignity for all, and in particular for migrant people, poor people, because they have a great culture and dignity, and we have to respect all of them.
Thank you, Aldo.
If I can add something about our important role, so every dermatologist has an important role to improve access to care to migrants population, and the Migrants Health Working Group of the International Foundation for Dermatology work in close collaboration in official relationship with WHO to improve access to care for all, including migrants and refugees, who are very often neglected population. So it's very important that we raise our flag, and we try to really to get a post in this international community, scientific community, to increase awareness, education about skin care, also in migrants and refugees, to improve access to care for all, including these vulnerable groups. Thank you.
Valeska, Aldo, thank you very much for your great work, and that you gave time to us for sharing your insights, raising awareness and red flags. Thank you, and bye-bye.
Bye-bye.
Thank you.
Before you go, a quick favor. If you're a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you're interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode. Thank you for your support. It means a lot. Until the next episode, take care of your skin.